Okay. All right. Well, David, thank you very much. Hi, everybody. Thank you for joining us tonight for 10 questions. And as David said, tonight's guest is Dr. Haering, who runs the public health office for the city of Alexandria. And boy, have we got questions for him regarding all things COVID, masks, and everything else, and a chance just to get to know him. Who is this guy who is who is helping to keep us safe during COVID? So, Dr. Haering, thanks for coming up. Thanks for showing up. I think he has. There he is.
I think I'm back on.
Okay. All right. So,
Okay, can I be heard?
yes, you can
Okay,
be
good.
heard. So, we'll just glad to have you with us. And so, as we talked before, we have the magic bowl of questions here. I'll be asking you questions about your work and, of course, and about you so we can get to know you better. So, are you ready?
Yes, I'm ready. I'm having a little bit of static, and I'm not sure if that's on my end or, but if you can hear me, I'm good to go.
Okay. Can you hear me?
Yes,
Okay.
yes. Hi, Jane.
Hi. Hi, Dr. Herring. Okay. First question. Should people get antibody tests to see if they're immune?
Thanks for that question. That's one of the things that we've actually been discussing and looking at, and the public health researchers, folks in the laboratories and academic centers, have been studying this ever since the realization that we have a new virus in the human species. At this juncture, the antibody test for this particular a role for individuals. Our antibody test studies that are being done by public health agencies. In fact, Virginia Department of Health is doing some of these studies, and we've asked to have some of our population included. Whether or not they include the population or not, it will still inform us about the prevalence or how common COVID-19 is in the population. Because one thing we know is that there's always more cases than there are the number of people who have tested positive.
Right.
So the short answer to that is at this point, antibody testing does not have a role to tell us whether or not a person has immunity. It can tell somebody whether they've had an infection in the past, but we don't know if that confers immunity going forward, and we don't know the level of antibodies necessary to confer that immunity. I anticipate that we will know more about that in the coming months and years.
Okay, so right now it's not necessary, but that may change.
Yes, that's
Okay.
correct. Mm-hmm.
Okay, well, how are you managing stress during this COVID time?
Wow, how am I managing stress? I'm managing it in every healthy way that I can imagine. First of all, I have a very strong yoga practice every morning. I spend just over an hour and a half. I do my practice, so it feeds me both from a physical, a mental, spiritual sides. Another thing is I have a really, really great team. I cannot overemphasize that, and I rely on them both professionally, but we also share things personally. I have a very strong family network that I also lean on and talk to daily. They don't live here locally or regionally, but I'm in communication with them daily. And then finally, I also get outside and go for a walk. And that's generally on the weekends because I'm working quite a bit through the week.
Okay. Well, since you mentioned going outside, do you wear a mask when you go outside, and what is the protocol for that?
Yes, I get asked that question quite a bit. The requirement for a mask is that in Virginia, it's a requirement for people who are age 10 and over in a public building. I get asked the question, do I need to wear a mask if I'm going to the park? I'm only going to be with my family. And no, you don't need to wear one, but should you carry one? And I definitely recommend that you carry one. And the reason is that you could be passing by somebody. For instance, when I'm hiking, I went hiking 2 weekends ago to Mason Neck State Park and carried my mask. And when you see people coming the other way, you can put the mask on. So that way it prevents any sort of respiratory droplets that you might be exhaling as you're walking past, and it helps to protect them. So it's a good idea to cover it. Frequently, we might be thinking, well, I'm just going to run out real quick. I'm going to run right back. You never know when you're going to run into somebody that you actually want to have a conversation with. You'll still be keeping the 6 feet distance when you're carrying on that conversation. But even then, having the mask is an additional layer of protection. And it's a protection wearing the mask, especially. So I still recommend taking a mask when you're outdoors walking. Yes.
Okay. And just let me add another question onto that. I've heard different guidance, and there's just all kinds of guidance out there, as you know. I'm just to clarify what the CDC says. If you're just passing somebody, if you're biking, if you're jogging, if you're walking, and it's a quick, 1 second and you're gone kind of exchange, is a mask necessary in those occasions? And is it, appropriate to make sure you have one on at that time?
That would be considered a casual contact when we talk about whether a person's a close contact or not. That passing by somebody does not count even if they had COVID-19. You would not be considered a close contact. So from a strict sense, it's not necessary. But I think from a prudent sense, it's a good idea to have it. So that way, when you see somebody coming the other way, I'll frequently wear mine over an ear, and that way I can just loop it up if I'm outside my condo or outside my office here at work.
Okay. Well, great. Well, thank you. Thanks for clarifying that. Now, how do you strike that balance between keeping yourself and others safe and not being completely housebound until there's a vaccine available?
Yeah. First of all, it's a matter of risk levels. And so if a person is, first of all, everybody can go out, particularly for essential trips, whether that's the grocery store or the pharmacy or a doctor's office. But there are some people who are at higher risk for severe disease. And what we mean by severe disease, we mean people that will actually end up in the hospital, maybe even need mechanical ventilation, and more susceptible to death. And people who are older, and you have to look at the different decades. Age 60 to 70 is at a higher risk than less than 60. 70 to 80 is a much higher risk than less than 70, and 80 to 90 much higher risk than less than 80. And then there's a number of underlying medical conditions, whether it's heart disease, lung disease, diabetes, obesity, any of those sorts of things put people at much higher risk. You really what sort of willing to take. And when you do go out, and even if you're not in those high risk categories, when you do go out, you'll still want to reduce your risk by maintaining the 6 foot distance, by wearing a mask, a cloth face covering, by hand sanitizing, with 60% alcohol or more, washing your hands when you get home. So those things will help to reduce the risk. So we're encouraging people to actually get out, go for a walk outdoors, because this really can cause this prolonged cabin fever. It can really run down our mental health if we're not getting away from the television, not getting away from the screens, and getting out into nature and exercising. So that's very, very important.
We did have a reader type in a question. Is this virus airborne?
So there's a different, I'm hesitating because I want to kind of back up and say, this is a brand new virus to the human species, and we're learning things. Just 4 months ago, we were telling people don't wear a mask.
Right.
If you're not a healthcare worker, don't wear a mask. Because at that time, we were saying it was strictly droplet. And there's two different ways of looking at this. There's droplet and there's aerosol. And it's really easy to remember. Droplet drops. And we were saying all it does is it comes out and it drops, doesn't go very far. And so we have to sanitize surfaces and wash our hands. We know that's still true, but we also know that it's carrying further than just droplets. And that's why we're saying 6 feet of distance is really, really critical. If a person's coughing and sneezing, it can go further than the 6 feet. If they're singing, if they're chanting, anything that breathing really heavy, and that's why the mask or the distance rule indoors is different. If you're at a gymnasium, for instance, the executive order requires that you have a 10-foot distance. So what we're starting to understand about this coronavirus is that it is by droplets, but it's also by aerosol, but not to the point that the aerosolization gets into an HVAC system. Because what we're not seeing, like when we saw SARS, we knew that was aerosolized because somebody in an apartment building, and I forget if it was Hong Kong or where, or Taiwan, that was sick on the 3rd floor. They got somebody else sick on the 8th floor, and they had no other contact. And the only way they were able to figure out, okay, how did the person on the 8th floor get it? It's because it got into the HVAC system. But that is not happening here because we're not seeing that sort of transmission. We're not seeing that sort of linkage between people.
Okay, thank you. And to the viewers, if you do have any questions for Dr. Haering, just please then type them in the comments. If we're not able to answer them right now, we'll answer them tomorrow, or at least try to answer them tomorrow when we come out with 5 more questions with Dr. Haering, which will be published by the Zebra online and on their website. So we seem to be stuck on masks tonight. How many masks do you own, and which is your favorite?
I own about 8 to 9 different masks, and I'm happy to talk about masks. I'll talk about anything anybody has questions about. And it's important to wash your mask after you wear it or anytime it becomes contaminated. My favorite mask actually is this one here, and a friend gave it to us at work, and I like it because it's soft, it is multi-layered, it fits well, and the straps that I use don't hurt my ears. You have to have a mask that actually works for you, or you're not going to wear it. But this is my favorite mask, and I'm really fortunate to have 2 of these. But this is my favorite one.
And speak now, so should you wash them every time you go out and wear one?
You should wash it at least every day. And
Okay.
if it becomes contaminated, then, if it gets soiled or something, you should wash it. It should be washed in hot water and then dried with a heater. Another thing, when you're wearing a mask, this is something that I don't think we emphasize enough. When you wear a mask, you shouldn't touch the front of it. Because if I touch a surface and I pick up the virus on the surface and then I touch the front of the mask, what have I done? I've presented the virus right in front of my nose and mouth, and I actually have a chance of breathing it in. So when you're handling the mask, you're handling the edges or you're handling the strap. Don't touch the front of the mask. And that's what we would mean by contaminated. It doesn't mean there's mud on it. It means that I've touched the front of the surface, and therefore I've introduced something on the front, and I don't want to be breathing that. It increases the chance if it's on the outside of this that it eventually will work its way in.
Okay, and you said to just wash it in very hot water and, hair dryer, a blow dryer to blow it dry at least once a day.
Actually, in the clothes dryer. Heat it in the clothes dryer. Yeah.
Okay.
Yeah.
Now, you had mentioned before the show, as we get into masks, there's people who have very strong feelings about wearing one or not. And you said that goes back as far back as, and maybe farther than the Spanish flu back in 1918 when there was a mask league or something.
I just heard about it yesterday, and it was the Anti-Mask League of San Francisco. And my guess is that it may have actually sprung up in a lot of different places. And I certainly understand the sentiment of not wearing a mask for a lot of different reasons. It's uncomfortable. Somebody else is telling me to do something that I don't want to do. And I definitely respect that. And I understand it. But personally, I also respect a couple of other things. And one is public health science. Back as I said a few months ago, we were telling people not to wear a mask. Something different, we adopt and we adapt things differently. And as we learned that wearing a mask reduces the chance of transmitting it, it helps me to demonstrate my respect for other people. And so by wearing a mask, it's not just about me, it's about my community, it's about my neighbor, it's about people that I don't know. Because the other thing we know from the public health science is that I might have COVID-19 virus right now, and I don't know it, because you can have it a couple of days before you become symptomatic, or you can have it and never become symptomatic and still transmit it to other people. And many of those other people could be people at high risk for hospitalization, ventilation, and even death. And so for me, it's really a demonstration of respect for my community.
Yeah, thank you. And I noticed that when you wear your mask, you wear it all the way up to the bridge of your nose. And I've seen people wear it under their nose. So is there a correct way to wear it?
Absolutely. Thanks for asking that. This is the incorrect way. This or up like this. This is the correct way. It really needs to cover your nose and your mouth both.
Yeah. And we just had a viewer comment that she lost both her grandparents during the Spanish flu in 1918. And I'm sorry to hear that. And it just goes to show that it does all of her grandparents. Yeah, all four. And I'm sorry that happened to her. So she never got to know them. And so now that we know what the safety protocols are, hopefully less people will lose their grandparents this time around. And why are some people hit more violently with the virus than others? And I'm not necessarily talking about older people or people with pre-existing conditions, but sometimes you hear about very healthy people who get ravaged by it and others don't.
You know, that's one of the things that really is surprising all of us, is that there are people who are in their 30s, in their 40s, completely healthy. They don't have any of the underlying conditions, and yet they end up in the hospital, or they end up even dying from this. And we really are still looking at that. We don't have those answers exactly. I know that there are some studies about different blood types that are more susceptible. I don't know the validity of all that. I don't know that we know much more. But that's one of the things that kind of highlights how important it is for us to control the things that we can control. We also know that there is a multi-system inflammatory syndrome in children. And that is occurring, and we really don't know why that occurs. It's rare, but it's also very severe. And when we say multi-system, it affects multiple organs, including the heart or the gastrointestinal system, the liver. And it can be really profound, requiring hospitalization. So we don't know exactly why it hits some people so profoundly. But again, what we want to do is control the things that we can control.
Okay. Well, part of the show is to get to know about the public health, specifically COVID, and also to get to know you a little better. And even the get to know you questions have all been about COVID and the mask. So we're going to switch things up a little bit and ask you a non-COVID question. And that is, what would be the worst job in the world for you?
The worst job in the world. Yeah. I would think, for me, it would be a job where I was not working with other people. On the one hand, I am somewhat of an introvert. One of my deputy city manager, who I liaise with, she and I talk about how we're each introverts, and yet we're in jobs where we need to be extroverted, but we get our energy by being alone. However, when I'm working, I really enjoy the teamwork that's required in public health. And this is actually the reason I got out of clinical work and came into public health, because I'd spent the first 12 years of my career working in clinics. And I came by way of public health in a circuitous route, and I've loved every minute of it since. And for me, working with other people is the key. If I had a job where I couldn't work with other people, could not interact, I think it would that would not be comfortable for me.
Hmm. Well, can you think of a job where you would be isolated that you would absolutely hate? Anything come to mind?
Um, you know, I've come across some things that like make X number of dollars a month trading stocks at home or something like that. And I just can't imagine where there would be any joy in that for me.
No amount of money would entice you to do that,
Right.
right?
No, no.
Okay, well, I'm afraid we're going to go back to another COVID question. Do you expect another surge of the virus in the fall or the winter?
We're preparing for a surge, and when we look at other states when they've opened up and when they've opened up too rapidly, initially, again months ago, when we were talking in public health, we were thinking, well, 2 weeks, 3 weeks after there's openings, we're going to see surges, and what we're actually seeing is that it happens about 4 to 6 to 8 weeks afterwards, especially around 6 weeks. And there's a number of different thoughts about that. And one is that even though there might be an opening up, that there is a change in behavior that lags a little bit. My concern is that as we open up and become more social, if you will, that people will become lax about maintaining a 6-foot distance, become lax about even staying home when they're sick, which is an absolute critical part of interrupting this virus until we have either treatment or a safe and effective vaccine. Become lax about washing their hands and sanitizing surfaces and all that. So what we're doing is we're preparing to prevent that from happening. We're watching metrics really closely. We're really advising people what they need to do to take care of themselves and their families, and from the business's perspective, how they take care of their employees as well as their patrons.
Yeah. Okay. Well, back to another non-COVID question. You ready?
Okay. Yes.
This is a good one, in my opinion. If you were frozen for 100 years and just woke up, what's the first thing you would want to know?
Frozen for 100 years and just woke
Yep.
up. I'd want to know, when we look back, let's look back 100 years, looking back at a pandemic 100 years ago. But then you look at all the progress that we've made as a species in the past 100 years, and then look at 1820 to 1920. So I'd want to know how have we progressed as a species? Where are we when it comes to consciousness, when it comes to being compassionate for our fellow human being, for domains of racism, domains of hunger and housing and poverty? What have we done as a collective to help address those big issues in life?
Yeah, that would be good. I'd like to know that too, actually.
Yeah.
We had a viewer write in and ask, should I wear gloves when I open the mail?
There's been no evidence that mail or packages from Amazon, FedEx, or UPS have carried the coronavirus and then somebody get it. As an abundance of precaution, you could do a couple of things. One, you could wear gloves, but even if you wear gloves, after you take the gloves off, you should wash your hands either in soap and water for 20 seconds or with hand sanitizer that has 60% alcohol. So I practice that myself, whether I'm opening the mail, a package, or when I bring groceries home. The coronavirus can last on surfaces for a period of time. That's why we recommend sanitizing surfaces a lot. It tends not to last as long on porous objects such as cardboard or paper. It lasts a little bit longer on a desk or on a metal object. So, and it can last up to hours. So that's why we're emphasizing the frequent sanitization of commonly touched surfaces, as well as the frequent meticulous hand washing.
Okay, 'cause it used to be a couple of months ago, they said to let your packages sit for 3 days, either outside or in your foyer. Wash down your fruits and vegetables with water, but the packaged foods, wash that down with soap and water. Is that still something that's recommended?
You can. You, I s- you It's probably not necessary that
Hmm.
you do that. I mean, it's necessary from just a common uh, getting rid of germs in general. Yes, definitely wash your fruits and vegetables before you eat them.
Hmm.
But I wouldn't see that you need to let a package sit for 3 days.
Okay.
That's not recommended at this juncture.
Okay. Now, have you been tested for the virus?
I have had no reason to be tested up to this point because I've not had any symptoms of infection. I've been very fortunate. I have been very careful at work, at home, in my social life of maintaining the distance of 6 feet and wearing a cloth face covering. But I would get tested if I became symptomatic. Absolutely.
Okay. Well, here's another non-COVID question for you.
Mm.
If you could invite any six people, living or dead, to a, of course, physically distant, 6 foot apart dinner party, who would you invite?
Wow. 6 people.
Six
Okay.
people,
Yeah,
living or dead.
well, I'm going to name a couple. In one of them, I can't actually think of the person's name because I'm reading this book that's called How the Subconscious Mind Drives Your Behavior.
Oh my.
And there was a contemporary of Freud who worked on memory. And actually, he was a brilliant German psychologist. And apparently, he was working on memory. And of course, which led to a lot of understanding of how our subconscious drives behavior. And that's a common theme in yoga philosophy, if you will. And at the same time, there was Freud who was saying that actually it was um, repressed memories that drove behavior.
Mhm.
And so the two actually had a conflict in their thought and they never met. And what I read was that Freud even came to Harvard at one point, and this other psychologist wouldn't even come to the lecture. And
Oh,
so I
wow.
would love to get the two of them together and
Yeah.
have them talk about uh, their differences of thought about how the mind works and how memory works and the subconscious and the unconscious. So those two, quite frankly, I think I better back up and throw them out of the mix. And I really enjoy having dinner with my family. Uh, so
Good
I'm still
answer. They're
blessed.
watching, right?
Yeah, well, I hope so. I don't know, but yeah, I'm still blessed to have my mom and my brothers and their significant others and kids. So
Yeah. Oh, that's so
yeah.
sweet. Yeah. Well, we're at 7:29. We have 1 minute left, believe it or not. So the last question I want to leave you with is from your vantage point, what can Alexandrians do, all Alexandrians do to help make our community better?
Mm, I would say relax. Even in these times of uncertainty, of great change, of turmoil, of social disagreements, I think it's important for us all to relax a little bit and find that place of a peace and compassion that we have first for ourselves and then for other people because we're all working really hard in one way or another and really just treating ourselves and treating each other with dignity and when I think that complex where person is. So find the ways that you can relax. It doesn't mean you're not going to do a lot of work and get a lot of things done, but it means do it in a relaxed manner and learn patience, learn that we don't have that much control over things. Focus on the things that we do have control on.
Thank you. Is there anything else you'd like to say, Dr. Haering?
I appreciate the opportunity to be here. I love Alexandria. I love the place I work at and love my colleagues. And so I really appreciate the opportunity to share this information with you and your viewers.
Well, thank you. And on behalf of David and me and the Zebra, thank you for spending time with us, for telling us about yourself and telling us a little bit more about COVID. And I would tell everybody, please stay tuned. In a couple of days, we're going to follow up with 5 more questions with Dr. Haering, which will be online. Thank you all very much. That concludes our show.
Thank you.
News in someone's life.